Welcome to SDSF Live. Please let us know where you're logging on from. I'm Nicole Shen from Texas, and this is Michelle from Michigan. SDS Live is brought to you from the Shwachman-Diamond Syndrome Foundation, providing support to families around the world. We are currently live from Facebook and YouTube today, Michelle?
I don't think so yet.
Oh, okay. Just Facebook. Okay.
Just Facebook, but it'll be on YouTube right afterwards.
Yes. So. You may comment and we'll see it in our feed. The show is public. Please do not ask or share personal information that you're not comfortable sharing. These shows serve as a library of topics on YouTube for families to access later. We're also going to be translated into your native language.
Hi, I'm Michelle, like Nicole said. I'm from Michigan, and I'm really happy to be here. I'm very excited for this show.
Super excited.
I would highly suggest hitting that share button right below it and sharing it to your whole feed. I don't think this is going to be SDS specific. I think it's going to be a great show for anyone that struggles with any neuropsychological issues. By far, hands down, neuropsych shows are our most requested shows and our most watched shows. So it's going to be a good one. And we've got two really great doctors today. Our guests this evening are Dr. Koo and Dr. Quinton.
Hi, ladies. Hi.
Hello, everybody.
Hello.
Thank you for joining us. So this is the first of two back to school shows we're going to have. So we want you guys to be prepared for back to school. A lot of kids are starting in August or September. So we're going to go over this show. We're going to link previous shows from Dr. Kerr, Dr. Green, Sonia, who's a OT, had a show on some sensory issues. We had a show on accommodations, and then we're going to have a second show this month on school accommodations. So you guys should feel very well prepared after these two July shows.
Yes, I know that Nicole and I both have children with neurocognitive issues, and it's something that's not really talked about as much as the blood. It's not talked about as much as the bone marrow. Sometimes it takes doctors a really long time to even listen that it is attributed to SDS and there is something going on within it, and it's not just coincidence.
We're really in the trenches right now. Our kids are a year apart. We're really in the trenches of this right now. So we're guessing we're going to have a really packed show. We have someone from Beaumont, Texas, Long Island, New York so far. We'll probably have a lot more guests coming on. So it's probably going to be a really packed show with a lot of questions. So ladies, we're going to turn the show over to you.
Absolutely. And I believe Dr. Koo's going first, right?
Yeah, I think so. Yeah.
The floor is yours.
Okay. And is everyone able to see my slides? Just making sure.
You're all set. We can see them.
Okay, awesome. Okay. So thank you so much for the introduction. So I don't know if I've met some of you clinically, but I'm Dr. Koo. I'm one of the bone marrow transplant physicians. I also take care of other marrow failure patients at Cincinnati Children's. I work very closely with Dr. Cass Myers, who you may all be a little bit more familiar with. So thank you so much for the invitation to come and talk about some of the neurocognitive outcomes. And I will be sort of touching on some of the data that we have been collecting from the Shwachman-Diamond Syndrome Registry, and then sort of other things that are coming down the pipeline as well. So the way that I have structured this talk is to go over some of the data that has already been published, which you may be familiar with, such as Dr. Kerr's study, who I know has been a guest on this show. But just to kind of make everyone sort of starting off on the same page, I just wanted to review some basic brain anatomy because it helps to kind of frame what structures of the brain are being tested in neuropsychological evaluation, and also some of the data that I'll be presenting refers to some of these structures. So in the blue here on the very left is the frontal lobe, and that's going to be responsible for our decision making, what makes up our personality, and for like gross movement. Below that in green is the temporal lobe, which is involved in short-term memory and in speech. And then next to the frontal lobe, more in the teal color, is the parietal lobe, and that's going to be what's responsible for creating spatial relationship and understanding spoken language. And then behind that is the occipital lobe in yellow, which is responsible for vision. And then below that in the gray structures are sort of the posterior brain. And so the cerebellum helps to perform functions in posture and balance, and the pons serves as like a network of nerves that help connect it to the spinal cord. The spinal cord will be able to connect to the rest of the nervous system. So looking at SDS patients histopathologically, so the SBDS gene is actually expressed in many different types of tissues that are very fast dividing, so including tissues like the lungs, small intestines, and other reproductive organs. And it's actually also expressed at lower levels in the brain. And so on the very right panel, there are some histology slides, and the dark staining in blue represents staining of the SBDS gene. And so there's positive staining in the lungs, small intestines, and the reproductive tissues, and then in the brain, which is highlighted in red in the bottom right corner. So there have been very small studies that have looked at or tried to look at what sort of brain differences there are in patients with SDS, but very little is known about any sort of wide-scale brain imaging features of the brain in these patients. And so one of the larger studies that I found in the literature is this MRI study of 9 patients with SDS and control subjects. 8 of the patients with SDS had some sort of learning difficulty. And in general, SDS patients had smaller head circumference, brain volume, structures near the back of the brain, that posterior fossa area, and then connections between the left and the right side were a little bit smaller as well. This is from that same study, which shows some representative MRI images from SDS patients. And so from this, in the panel labeled D, so the posterior fossa structures, so what's labeled P, M, and V, that's the cerebellum. Those structures tended to be a little bit smaller in the patients with SDS, but the paper didn't really go into much depth about how any of these findings really correlated with any sort of developmental challenges. So how they really relate to how people are having issues with neuropsych symptoms, that's really unclear how they're related. So what do we know generally about the neurocognitive phenotype in people with SDS? So it's not very well characterized, and a lot of the data that we have currently is very old, and it's highly variable in what's reported in the literature. So even in some of the very older studies, like decades ago, even from the original Dr. Schwachman himself, he studied 5 children and reported that there was normal motor and mental development. And there was a follow-up study that had similar numbers of patients in the 1980s that showed that there was actually some cognitive developmental delays and decreased intellectual disabilities in people with SDS. So the sort of pivotal paper, I know Dr. Kerr has spoken on the show before. This was published back in 2010, and it's the most heavily cited study, and it's also one of the more robust studies that we have that looks at neuropsychological function in patients with SDS. So this study in particular, they looked at 32 children with Schwachman-Diamond syndrome, and they also compared them to 13 of their unaffected siblings and 20 patients with cystic fibrosis, because the cystic fibrosis patients share some of the phenotypic manifestations of patients with SDS. And they actually incorporated real neuropsychological testing and looked at cognitive testing. And they also went one step further to look at what were some of the things that the parents and families were very concerned about. And so from this study, what they found in the children with Schwachman-Diamond syndrome is that about approximately half had delays in development and some sort of learning. And they also identified some concurrent behavioral problems, with some of them including ADHD and oppositional defiant disorder. So just to delve into the data a little bit more from this study, they did do formal IQ testing in this patient population. And so what they actually ended up finding is that there was a huge range of cognitive abilities that were found in terms of the IQ. So patients were testing anywhere from less than the first to greater than the 90th percentile. And as a group in general, patients with SDS tended to score lower than siblings and compared to those with cystic fibrosis. And about half of patients with SDS fell below somewhere below the 25th percentile. But I will say that this data, although 32 patients seems like a lot more than sort of what's been reported previously. It is one of the largest studies that we have in the literature. It's still a very small cohort of patients. So many of the findings, while robust, are not necessarily generalizable to like a huge population of these patients. So this is also a snapshot of some of that data where if you look in the keys here, so in the white bars, that is the unaffected siblings. And then in the lighter gray are the CF controls. And so in the dark gray, those are the patients with SDS that are being compared to CF controls. And then in black are the scores for SDS patients that are being compared to unaffected siblings. And so they actually took neuropsychological testing scores in performance IQ, visual processing speed, executive problem solving, and motor integration. And so what they found generally is that the scores for patients with SDS compared to siblings and CF controls were lower in overall in these four categories. So I think to summarize the findings from Dr. Kerr's study, there was tons of variability. So there wasn't really one sort of set generalizable conclusion from some of the functioning that they were able to find in this patient population. What they did find is that patients with SDS did not have deficits in memory or basic language. And there were some relative weaknesses in attention, higher order language, perceptual skills, and reading skills. So that's what they were able to conclude from this study in particular. One of the key things I think that came from this study, and another study that was published later, about 2 years after, by Parabelli's group, is that they were able to explore what families and parents were most worried about. And so they expressed their largest concerns in attention problems, social skills, and physical symptoms. So I think that more relates to the concurrent behavioral issues. So like ADHD, oppositional defiant disorder, those are the things that they express most concerns about. But executive skills, so being able to do like activities of daily living, that was not reported as a concern. And the follow-up study in 2012 shared that parents of young adults had same concerns as the actual patients themselves. So there were generally strengths and weaknesses in all. So we have currently, I know that many of you are probably participating if you are part of the SDS registry. We have actually compiled some of the neurocognitive outcomes, and we have registry data that have evaluated 133 subjects to date. And some of this data that we have compiled includes highest education level that's been reported by patients or their parents, a lot of the school issues, working status, and developmental neuropsych testing concerns, and any sort of other neurologic diagnoses. This is unpublished data, so I unfortunately wasn't able to share some of that data with you today, but we are hoping to get this published hopefully by the fall of this year. But before we do that, we actually wanted to get more information for our families who are members of the SDS registry. And so we actually just recently received IRB approval to conduct this survey to better understand and learn about some of these issues. and how we can best help our families. And so this is a flyer that I believe Maggie Malsh from Boston will be posting onto social media sites. And then once we're through with some of the final testing of the survey, if you are a participant in the SDS registry, you should be getting an email, hopefully in the next week or so, about filling out this survey. And then once we've compiled all of this data, we're hoping to get this published and get this information out there for families and patients with SDS to be able to kind of figure out what sort of resources could be available and to help guide care for people with SDS. I think that's what I have. Thank you so much for your time and attention. And I think I was going to turn it over to Dr. Quinton.
Okay. Are you guys able to see me and hear me?
We can see you. We're just waiting for your slides to come up, and then I'll give you the go ahead.
Perfect.
All right, you're all set. Floor is yours.
Okay, great. So I am Dr. Quinton. I am a neuropsychologist at Cincinnati Children's Hospital, and I specialize in working with patients in our Cancer and Blood Diseases Institute. And so one of the populations that I serve is the bone marrow program, and that is how I got connected with Dr. Myers and Dr. Koo, and have started getting involved in research on SDS, and I'm really happy to be able to be here and talk with you all today. These are the things that I am planning to cover over the next 15 or so minutes. So I'm going to be talking about what is neuropsychology, what is it not, what can you expect in a neuropsych evaluation, what are the steps involved, what's being assessed, how often should these happen, and then also give you some resources and tips for ways that you can help your child if you have any concerns with neuropsychological functioning for them. So next slide. Okay, so neuropsychology is a subspecialty of psychology. So a neuropsychologist is a licensed psychologist that has extra specialized training in the brain and brain behavior relationships. And so we really focus on performing evaluations of people's thinking, mood, and behavior. So some of the questions that might be answered through a neuropsych evaluation include: how does my child learn? How do they process information? How do they regulate their impulses and emotions? A neuropsychologist does not typically provide ongoing therapy, so we're not usually involved in treatment per se for mood or behavior problems, and we are not physicians, so we don't typically prescribe medication. That is something that we refer to physicians for. Next slide. A goal of a neuropsychological evaluation is to see if a person's medical condition or the treatment that they're receiving is having any impact on their thinking skills, mood, and behavior. And we do this using standardized and normed tests as well as questionnaires. And so these tests and questionnaires, they've been given to thousands of people in all sorts of countries, and we are able to then compare how your child does to other children their age. And so we're looking to see, do they fall where we would expect for their age, or are there areas where they're having more difficulty than we would expect for a child their age? Some of the goals of the evaluation are to identify any areas of strength and any areas of weakness that your child may have, identify if there are areas where they could use some more support, in fostering their development, and then identifying specific ways that you can help your child at home, at school, or through therapy or medication. Next slide. The skills that are typically assessed, so usually a neuropsychological evaluation focuses most on intellectual and cognitive functioning, so overall intellectual functioning or IQ, as well as very specific cognitive skills, things that the brain is responsible for, like using and understanding language, processing, understanding visual information, being able to focus, concentrate, and sustain attention, being able to learn and remember new information, quickly processing new information, and then executive skills, which are this kind of umbrella term for the skills that are required to execute tasks. So it's things like being able to get started on something, being able to resist distractions, resist impulses to do something different, being able to organize your approach to task. Those are all things that fall under that umbrella of executive skills. And intellectual and cognitive skills we assess through formal testing. And then sometimes we will also assess some academic skills, things like reading and math and spelling. And then the other areas, so a child's emotional, behavioral, social functioning, their adaptive functioning, that is based on information that we gather from parents and teachers on standardized questionnaires. And so that's where we get to learn more about what they are seeing in day-to-day life. And again, comparing it to other children their age and seeing if there are things that are above and beyond kind of what we would expect for a child their age. Next slide. The components of a neuropsychological evaluation, the specific process can vary from provider to provider or site to site, but in general, these components are always included. So typically it starts with an interview with the parent. The child might be included as well. This is where the neuropsychologist gathers background information, learns more about your child's history, about things that you're currently seeing, any concerns that you have or questions that you have. Then there is the one-on-one testing with the child. That is done either with a neuropsychologist or with a technician. And it involves doing a whole bunch of different activities to look at those different thinking skills. So it's stuff like we give them blocks and show them a picture, and they have to put the blocks together to look like the picture. We might ask them to answer questions or tell us what different words mean. We might ask them to give them a list of words and ask them to remember them 20 minutes later. It's nothing invasive, so there's no needles or pokes, there's no brain scans as part of it. I've had some kids tell me that it kind of feels like they're at school, but they're the only student, like it's working one-on-one with a teacher. And the testing it can vary anywhere from 2 hours up to 6 hours, just depending on the child's age, what the concerns are, how well they're able to stay focused and engaged. And then following testing, there's typically a verbal feedback session where the neuropsychologist will meet with the parents and maybe with the child and talk about the results, any diagnoses that seem appropriate, and then any recommendations that they have for next steps. And that is typically followed by a written report that summarizes those results and recommendations. That's, of course, shared with the family, and then with the family's permission, we share it with other doctors and with the school. Next slide. I think in general, it can be helpful to have these evaluations done at kind of key developmental time points or transition points throughout childhood and adolescence. So typically, it's helpful to start around the time that a child starts school, so either during pre-K or kindergarten. And then every few years, children kind of go through this developmental jump where it can be helpful to do a reevaluation to make sure that they are set up for success at that next step. So around third or fourth grade, that's when children transition from learning how to read to reading to learn. Middle school can have a lot of demand on a child's executive skills, their ability to manage their time and problem solve and organize. And typically, when kids go to high school, those demands increase even more. And then it can be helpful around the time of transition to adulthood to do an evaluation just to prepare the child for whatever steps come next for them. In general, we like to do evaluations at times when the child is fairly medically stable. Um, that can be hard to come by sometimes in kids with SDS, but in general, as much as possible, if the child is stable, then we know that we're getting a good snapshot and it's not being colored by any kind of acute illness that might be impacting thinking skills at the moment. There are some other times, though, to consider an evaluation. So if a child is going to be undergoing bone marrow transplant, it can be nice to have baseline testing and then follow-up testing to see how that might be impacting their thinking. If there are any significant neurological changes, so if this child starts having seizures or has a head injury, and then really any time that the child's having significant difficulties in day-to-day life, you can consider an evaluation at that time. Next slide. If you are not already connected to a neuropsychologist, here are a few tips for how you might be able to find one. You could try talking to your primary care provider, your child's pediatrician. If you live at all close to a children's hospital, most children's hospitals, at least in the US, even smaller ones will have at least one neuropsychologist on staff. Certainly, any of the more major children's hospitals, so like Cincinnati or Boston, if you know that you're going to be traveling to one of those hospitals to get some specialty care, trying to arrange in advance to also have a neuropsych evaluation done while you're there. I know at Cincinnati, we currently schedule about 3 to 4 months out. So it works best if you know that far in advance that you're going to be coming to town, and we can try to work it out so that we can see you while you're here. The nice thing about COVID is we have more access to telehealth now. So a lot of us are able to do our intake interviews and our feedbacks by video with families in whatever state they live in. And then it's just that actual testing appointment that has to be done in person. And here's a link to a website that has a really great directory of board certified neuropsychologists. So this can be helpful. You can plug in your location and it will let you know of any nearby neuropsychologists that are board certified. Next slide. Okay, so other things that you can do if you have neuropsychological concerns for your child, if there are any learning, executive, or cognitive concerns, I think the first place to start is meeting with your school team, talking about an educational plan like an IEP or 504 plan, some common accommodations or preferential seating, extended time, reduced assignments. But there may be other more intensive intervention that a child might need. Some helpful resources for that. The The website Rights Law has a lot of information about special education and how to request services and evaluations. The website Project LearnNet is a really nice website. It was designed for parents of children with a brain injury, but I think it really applies to any child with neuropsychological challenges. And what it does is it breaks down the different cognitive domains, and it gives you concrete strategies that you can use to help your child in that area. And then Harvard University Center for Developing Child has a really nice website about executive functioning in particular and how to develop that throughout childhood and adolescence. Next slide. These are some of my favorite books that I often recommend to families. The Smart but Scattered books, those focus on attention and executive skills, and they're really nice because they have a quiz at the beginning that you can take, and it'll help you identify specific areas of weakness and then direct you straight to those chapters. So you don't necessarily have to read the whole book start to finish. Next slide. For attention, behavior, or mood related concerns, I encourage families to consider therapy, either individual therapy or family based. If the concerns are with things like anxiety or depression, then we know that cognitive behavioral therapy can be really helpful for children. It helps teach them coping skills that they can use to help themselves feel better. If there are concerns with oppositional behavior or aggression, that tends to respond well to parent management training, where the parent is taught strategies for reinforcing positive behavior and having consequences for negative behavior. And the website Psychology Today has a page where you can input your location, your insurance, the type of therapy that you're looking for, the age range, and it will connect you with local psychologists, counselors, and social workers. Very helpful. If there are significant concerns with attention, mood, or behavior, then consulting with your doctor about medication is always advised. And then these are some websites that have a lot of information about all sorts of mental health concerns that children or adolescents may run into. There's a lot of information out there, and sometimes it's hard to know what you can trust. And so these are some specific websites that are really reliable. You can count on them for some good information. Next page. Here are some additional books that I really like, including Dr. Green's. Oops. Okay. And I just want to point out the one in the middle on the top, What to Do When You Worry Too Much. That is one that is written specifically for children, and it's part of a whole series. It's published by the American Psychological Association, and they have books on different topics like what to do if your temper flares, what to do if you're too shy. And they give kids really helpful ways to understand their own emotions and then cope with them in more helpful ways. Next slide. Finally, I just have a few things about social skills problems. So looking for social skills groups, either through school or in the community. You can look for that on that Psychology Today website. finding extracurricular activities or setting up kind of supervised play dates where there's an adult that is facilitating the social interaction, that can be really helpful for children with social skills problems. And then there's a number of online resources that are really helpful. The Superflex curriculum is a really helpful one for giving kids language about social skills and how to build them, as well as social stories. And then Elizabeth Sauter's website is really great as well. So that is what I have. And I'm happy to answer any questions.
I'm obsessed with all those books.
Nicole and I were messaging back and forth. I'm like, that's a good book. I have that book.
I have that one.
I linked a couple of them in the comments for people to check out.
And
and then a couple of my personal favorites that go along the same line, sort of like a workbook for ADHD, and then How to Train Your Angry Dragon series. We love the dragons. Oh, there's
really
unicorns.
good resources.
If dragons aren't your thing. There's like a whole, I love how far social skills curriculum has come. It's not so taboo anymore to need help understanding why we're angry or how to word it. And then when you said Superflex, I was kind of over here freaking out because we have the curriculum on our shelf and we have zones of regulation all over our house.
We love all those books. And the Smart and Scattered, I think, has an adult book too. Am I correct? Yes.
I have read that one and found it very helpful.
The Smart and Scattered, the first book, it was so good to like how you were saying to do the surveys first to see like where you're at as parents. And we didn't realize how far off we were ourselves to help our son. I was like, oh, we're not doing so great ourselves.
I think we think we have it all together, but we don't.
Well, we got a lot on our plates. The first question we had was, if you're an adult and young adult or, whatever age adult, should they seek out a children's hospital, right? Because like for hematology needs, sometimes the children's hospitals are a better fit that know Schwackman-Diamond better. Or what would you recommend as resources for the adult SDS patients?
So I think it varies from place to place. I know at our hospital, I am able to see patients up to age 25.
That's fantastic. Okay.
Older than that, it kind of is like a case-by-case basis. If your questions are really about employment and work-related accommodations, I think in that case, you're probably better served by a neuropsychologist that typically works with adults because they just know that world better. That directory that I linked to, you can filter by pediatric or adult. So it includes both kinds.
And
we'll grab that slide and those links and we'll post them in the comments after the show. So that way, if you didn't write it down, we'll have it.
So exciting about the registry survey because it's going to incorporate so many more different ages and because it's been limited. I didn't realize it's been limited to just children so far. So that's really exciting to get all that data. That's fantastic. When do you think that survey is going to be posted for us? Soon?
So we're in the final testing stages of it. So I think we are anticipating that it should be circulated in the next couple of weeks since it's already been reviewed and approved by the Institutional Review Board at Cincinnati Children's. So as soon as like we've worked out like the logistical kinks of like the actual Red Cap program, I think it'll be ready to go.
That's so exciting. We'll of course repost it on the foundation page.
Absolutely. Whenever we see it, we'll share it however we can. We'll
make sure we get good participation for that. Michelle, do you want to take those an autism question that came in?
Yeah, so someone jumped on and said, how common is the comorbidity with autism and SDS?
So of the updated registry data that we have, so we recently kind of looked at the data again in 2020. And I know that there was like a transition period in the registry moving from Cincinnati to Boston during that time. So of the 133 patients, we only had information for 22 patients and families. So of those 22 patients, about 5% reported autism concurrently. So really that's one patient. I think looking at the data, ADHD tended to be the most common. Almost half of those families reported ADHD most commonly, and there were other concurrent mood disorders too. So things like anxiety and depression were also in that realm and also reported by families.
Spoiler alert, we're most likely going to ask you guys to come back on to give an ADHD show, because that's a very highly requested as well. Of course, after your registry findings, once that's published, but
Definitely.
we'll probably be asking for an ADHD show.
I would personally just love an ADHD show as an adult
and a
with
lot
ADHD, with some
a
kids
lot of
with
the
ADHD.
parents. Yeah, it's not just the kids. I mean, you don't have to have Shwachman-Diamond syndrome to have ADHD, and it sometimes makes this life a little more challenging.
We had a question come in that says, I'm an SDS adult with small head circumference, but a high IQ. I also have ADHD and attentive type. And I'm also a high school teacher who works with neuroatypical students. Please comment on enhanced creativity and problem-solving abilities in ADHD kids and adults. I often say that ADHD is my superpower because I can do a lot of things very well, but not for a long period of time before I do something else.
Yeah, I mean, I think there is a lot of overlap there. So children that we call it twice exceptional within the psychology lingo. So that being somebody that has a neuroatypical condition such as ADHD, but then also has areas of giftedness, above average intelligence or creativity. Our neuropsych tests are not very good at always measuring all aspects of giftedness and creativity, unfortunately. And so, yeah, I think there's a lot of assets that people have that go kind of under recognized.
Yeah. Is there going to be data, or are you guys going to be looking at data of like pre-transplant or post-transplant, right? Because that could maybe, Dr. Koo, that's kind of how you got into this work, right? Because you were working with transplant patients, right? So
yeah. And I think we have some data. I know Dr. Quinton and we've actually reviewed our institution's sort of longitudinal data that we have available. It's actually pretty sparse because it's very hard to get connected with neuropsych evaluation and then to return for these evaluations and testings. It's hard for families because once you've done transplant, you get to day 100. If things are great, you go home. So it's hard to come back because they can be multi-day visits oftentimes. And so we don't have very much data. So we only have like a few patients who, maybe a handful, like no more than 5, I think, that have at least 2 years or more of longitudinal data. So I think that's also what will be important for this survey that's coming out to identify what are some of the hurdles that are preventing a lot of these families and the patients from engaging in these types of services. So
that's what we had an informal survey through SDSF, and we found that a very high amount, I think it was like over 75 or something, didn't have school accommodations, but only over 90% said that they were having learning disabilities or behavior disabilities. So that's like a really big disparity. I think just getting whatever the proper diagnosis is per state or whatever they need, a lot of us are saying, we see this. Can you help us figure out how to get the right services?
Yeah. I know you had mentioned that since COVID, a lot of things that made telehealth a lot easier, which is one of the silver linings I've found of COVID, that things are easier to get into appointments where you wouldn't have been typically able to before. And I know you'd said that neuropsych testing typically needs to be done, obviously, in facility. But is it something that, like, we've had neuro testing or neuropsychological testing done up here in Michigan? Could you use that data that we had?
That's a great
does
question.
it have to be in a controlled setting, even though if they were using the same standardized tests?
Yeah,
that's a great question.
You could do like a consultation with a neuropsychologist, and share. So when we do our evaluations, I ask for any previous evaluations that a child has had, either through school or other neuropsychologists. And you can use that data as like a comparison point over time. Absolutely.
Mm-hmm.
That's the nice thing about these tests being standardized, is that it does allow for that comparison.
Well,
How
the
would
register.
that? Oh, I was just gonna say, how would I know we've heard from people before that getting information to the registry has been
Mhm.
kind of confusing and hard to get there because it's not as easy as going, through Care Everywhere or My Chart. What's the best way to get that data to the registry?
Yeah, that was my question. Or are they wanting that data? Are they wanting that?
They do want that data.
Yeah.
It's actually in the annual kind of follow-up surveys that are sent
Okay.
through the registry. And that's where we have been able to pull a lot of this data from,
Okay.
and updated it from the 2020 was like the last time that the data was input for the registry. So as long as you're so we're even collecting things like, are you using concurrent services like PT, OT, speech services? Because
Right.
that's all sort of within this umbrella. Like, are you getting additional adjunctive help outside of, just neuropsychological evaluation and testing? So all those things are asked in those annual follow-up surveys. So I think just answering those to the best of your ability we'll be able to kind of get more up-to-date data from our families.
Right. So just so I understand correctly, not just the survey questions. You guys are wanting any neuropsych evals or anything, because we tend to send like all the blood stuff, the bone marrow biopsy stuff, but you guys are wanting all the neuropsych evals and all that as well.
Well, there's questions on this, the annual follow-up surveys, asking about like, have you had, I think, certain testing done, or what grade are you in? So those are all within that umbrella too. So that's how we're able to kind of keep track of longitudinal data.
Okay.
So I think trying to answer that as much as you can when they get sent out for the REDCap.
So Savannah just asked about, she says, have you all found that bone marrow transplants have impacted neurological functioning? So we just asked that question. Are you guys looking before and after? So
I thought you were reading Savannah's comment when you'd said that, but you weren't. You guys are just on the same wavelength.
No, I didn't see it actually. My screen is blocking it. Yeah.
I think we are, in the very few patients that we have looked at it, there is some decline, but this isn't just specific to patients with SDS. This is a risk that we know is true of all bone marrow transplant recipients.
That's really interesting.
That's why it's important for all bone marrow transplant patients to be kind of longitudinally followed and make sure that we, at the annual follow-up visits, even like 5-6 years out, we're still, asking these questions, because anyone that gets radiation, chemotherapy, will be at risk. So it's not just specific to patients or people with SDS that go through bone marrow transplant.
So you guys will also be seeing, is there anything SDS specific to longitudinally through what you're looking at? Yes. So they're already monitored after transplant.
We ask about just generally, are you having like academic school issues? That's sort of how we kind of screen for these things. Behavioral issues, any concurrent medical diagnoses that have been identified locally by their PCP, etc. So those are all questions that we ask.
Okay, great. There was so many great resources that you guys posted. We really appreciate them. I hope everyone uses them. If you are, especially if you have a young child, it's really critical to get them the services they need as soon as possible. I know Texas Children's Hospital, where we're at, has really started creating a program for SDS kids, not like waiting for the parents to say, I see a problem. Like they're proactively now, starting at, I think, age 2, following them and just seeing, is there any gaps or where they can help, which I was really excited about. Not just waiting for us as parents saying, we need help, please help us.
Yeah.
A lot of it, I think, is because our kids are in transplant or home a lot or not in school. So a lot of it, I think, is written off as, well, they've been home and weren't in school yet, or they were in transplant. We'll see how they do. And then they don't get the services they need fast enough. So there's like a lag.
Yes, we've definitely heard that. We had We homeschool, however, we do go to a public partnership where they can receive services if they need to.
Mhm.
And I remember they did our neuropsych evals on like day 1 of Nathan's first day in school ever. So it was like he was at
That was
like
great.
the best rock concert of all time, totally happy. And they're like, everything's fine. I'm like, okay, but maybe we need to just like try it again in like a couple weeks. And
Right.
then that's when it showed. And
Yeah.
it's very, very interesting. I think, like Nicole said, there's such that gap of people who say they need services,
Mhm.
but they can't get them and they don't know how to get them. And there's never been an easy, oh, you just do this answer. It always seems like a fight and a struggle. And
Microcephaly comes up on our support page quite often.
a lot.
And it doesn't always correlate to low IQ or behavior issue. I could say my own son.
Yeah.
That are lucky. We're lucky that our neurologist was like, let's just follow him, and see how he does. And it wasn't set in my brain that he was not going to do well. And we see other parents posting that, like, how's my child going to develop? So that's what the data shows so far, right? It's like not that microcephaly doesn't always mean intellectual issues or
No.
developmental issues. Okay. So that's
Yeah,
really
and
great, reassuring for
yeah.
families.
And a lot of the data available, they're very small cohort studies, so you can't really
Mhm.
make a whole lot of
Right.
generalizable conclusions. We actually have also collected some neuroimaging findings, and the vast majority of the patients have normal brain MRIs or head imaging. So
My son just had a
yeah,
normal. Yeah.
yeah. So you can't really make any sort of conclusion based on some of these findings, like
We are
how they're going
so
to do.
excited for the registry. Survey. It
Yes,
really needs to be
yes.
updated. I'm so excited to be more inclusive of adults and just more patients. That
And I
data
did
is going to,
link the registry in the comments. So if you're not on the
to join the
SDS registry
registry.
yet, we will always encourage you to join the SDS registry because we can. There has to be so many of us before they can put pieces together.
Mhm.
There's just not enough, and I don't want any more of us. But like the ones that there are, let's
Let's
just
help
make
each
it
other
as
out.
easy as possible for them to make assumptions
And
and not
symptoms
assumptions.
really vary. Symptoms
Yeah,
can
Yeah.
really
Mhm.
vary. So
Yeah.
absolutely,
we need to know all those symptoms are important, even if it's a
Mhm.
absolutely.
small group.
Absolutely.
Anyone else? I think that's.
Jackie had said that if you're
Oh.
in New York State, there's a very robust early intervention program. And if you have a young child with SDS, please ask for an evaluation. I do know Michigan has an early intervention program as well. And
Mhm.
I think a lot of the hard part with that is that if you homeschool, you don't necessarily, it's still available to you, but you don't get the flyer about it or the if your
Yeah.
pediatrician isn't as well versed in that it exists, you kind of have to seek it out. So
Yeah.
I would just
State
search
by
out into your
state.
state
Yeah. Yeah.
and see
Or
if
your
there's any early
ask your
intervention
pediatrician,
programs. And
maybe. Yeah. That's a good one.
absolutely.
Yeah, I
This was
always
awesome.
encourage families with young children, if you have any concerns, contact your local school district and ask about
Mhm.
evaluations through there. They can start that IEP process at a young age or even earlier than that. Yeah, look through your county for resources.
And this is always true of every show, but I just want the families to know you guys aren't alone. Like a lot of us are experiencing these things. You're not going crazy. And it's really nice to have doctors looking at this closer and listening to us. So it's really reassuring and exciting. There's a lot of attention on the other life-threatening issues, and that's important too. But this stuff kind of colors our day and is just as important. So it's so exciting. So, any other questions? I think we're
I
good.
don't think so. I'm sure we'll get more.
Yeah.
I'm so sure we'll get more.
So we're definitely going to ask you ladies to come back on when you guys get those registry data.
Yes.
Um, so we're really excited about that. So just
Yeah.
let us know when you guys will post it on your social
Yeah.
media page.
And
Yeah.
I'll keep an eye out for it, and then I'll
Yeah.
share it out and get it all set that way. And we do have a couple of shows still coming up this month that are going to be extremely beneficial. We've got a school accommodations show, which is a piggyback to this show to help prepare for schools, IEPs, 504s, everything you should be asking for, you can ask for, things you might need to ask for, how to ask for it. And then we're going to kick off our kind of camp series, I guess, because we're not going to Camp Sunshine this year, and it's a little sad. We're going to do an SDS 101, hematology 101, GI issues.
So we've done those shows before, but we're bringing them back there's a lot of new patients. People have new questions. So, and we've linked, wherever the links are, we've linked Dr. Green's show, Dr. Kerr's show, and the sensory show. So please watch those as well. Dr. Green was like a celebrity when we had him on. He was supposed to be our keynote at Camp Sunshine, and then COVID came and was like, oh, we lost him.
No. Well, there that goes.
But that was still a good show to watch.
Very good show.
So thank you so much for your time. Thank you so much for everything you guys are doing. And thank you, Greg, for our behind the scenes tech. We would be lost without you. So join the registry, be looking for the survey. We're so excited about that. And thank you, ladies. Have a great night.
Have a good night, everybody.
Yeah, thank you.
Good night.